Good morning, everyone. This is Mike Quaranta. I'm president of the Delaware State Chamber of Commerce, and let me welcome all of you to joining us this morning on our Return to Work Safely, the plan for contact tracing. This is one of a series of webinars and audio calls that we've had over time. We've had healthcare leaders from around the state. We've had the governor twice. We've had the president of the Philadelphia Federal Reserve Bank and other economic leaders in the area and in our state. And this is yet another way in which we're trying to impart first-person information to business leaders around the state to try to help them understand our new set of protocols that we're all going to have to help out on. We've talked about testing and screening, and contact tracing is a logical extension of all of that. And so we thought we would bring this topic to everyone today. We've done a two-pager that's on our website that you can find that helps people return to work safely. This is pretty intuitive stuff, but if you've not seen this, it's just a quick rundown of CDC and OSHA and best practices that have been developed from a range of sources, and it's all curated into one two-page document. You can find that on our website at dscc.com, and I would draw that to your attention. I also want to take just a quick moment to mention that next Thursday, we're also going to have the next in our series. We've got an important subject, as we've got a lot of folks who are going to need to find a new opportunity because sadly they're not working right now, and perhaps the business that they were working for just isn't going to return, or it might return with far fewer people. So there are some opportunities to upskill our workforce with 5-day-a-week, 8-hour-a-day training opportunities, and we will welcome Delaware Labor Secretary Saran Cade and Ron Painter from the National Workforce Development Board Association in Washington, D.C. to talk to all of us about retraining ideas, innovative approaches in ways in which we can help put people back into meaningful work and into the workforce. With that, we couldn't do this without our members and without our sponsors, and let me thank Nick Moriello from Highmark Blue Cross Blue Shield here in Delaware for sponsoring today's webinar. Nick, always appreciate your insights on all things related to healthcare, and appreciate your sponsorship of all this. So let me turn it over to you for a few words.
Sure, thank you, Mike. And I just want to take this moment to thank you and your team for putting on these series. I know this particular topic today, we hear from a lot of our employer customers here at Highmark how back to work and returning to work is top of mind for them. So I know this is a really timely and important topic. So thank you to you and your team for doing these. I also wanted to take a moment to thank, this is no better time than the present, just to join all those thanking and an appreciation for all of the healthcare professionals out there during this time, and everybody in the essential business that up to this point have been helping everybody in their communities. And also wanted to take a moment thanking our speakers today, both Dr. Walker and Major General Barry, for their leadership in these times and helping guide our state through this. So just very appreciative to do our part, and happy to be here today. So thank you, Mike.
Nick, thanks very much. Really appreciate all that you're doing, and thanks to everybody, all the men and women that work at Highmark for all that they do for the community as well. With that, let me do a brief introduction to our speakers. As Nick alluded, we've got Delaware Secretary Kara Odom Walker, who's going to go first, and then we're going to turn it over to General Mike Barry from the Delaware National Guard. He's the Adjutant General of the State of Delaware. So let's start with Dr. Walker. Doctor, you are on.
Hi, everyone. Thank you so much for the opportunity to present on Delaware's plan for contact tracing. I'm Dr. Kara Odom Walker. I serve as the Cabinet Secretary for the Delaware Department of Health and Social Services. Under our department is the Division of Public Health led by Dr. Carol Rote, and I'm pleased to share our plan for contact tracing with you. I'll go through some introductory comments and slides, but I really want to just focus on the need to make sure that we have a robust plan for contact tracing in place. Next slide. This slide shows the concepts of boxing in the virus. The overall goal is to make sure that as we reopen, we are focused on ensuring we have robust testing, isolation, quarantine approaches, and we're finding the virus. This is the essence of this approach, and this is from the former director of the Center for Disease Control and Prevention, Dr. Frieden, who has said that what we need to do right now is make sure we're managing any future wave of infection. Right now, we are optimistic that we are in a downward trend. We have flattened the curve successfully in Delaware. And so the next effort that we have to have in place throughout the summer is ensuring that we're managing and expecting fewer and fewer secondary infections from those who are infected. Next slide. So there are 4 steps that are critically important for contact tracing. The first is that we isolate individuals who are positive. So we are working to identify and interview COVID positive, probable positive cases, and ensure those individuals are staying home and isolating for 14 days to prevent the spread. The second step is making sure that those individuals who may have been in contact with positive cases are self-quarantining for 14 days. We have to make sure that we're reaching out to any possible contact and that they monitor their symptoms, they are tested if necessary, and that we're working with them closely to see if they become positive. The third step is monitoring both index cases and contacts during their isolation and self-quarantine as they determine when they are cleared from illness and they are no longer infectious. We also recognize that a big part of contact tracing is to make sure that we have appropriate resources in place for those who are isolating and self-quarantining, that they can actually stay home and do so safely. Sometimes that includes looking at housing, food provisions, and prescriptions and the rest. So we're working individually, case by case, to make sure those resources are in place. Next slide. Contact tracing is essentially the extreme challenge of what we faced from the beginning. We started off with just a few cases, and our small epidemiologist team, strong and mighty as they are, just could not keep up with the number of cases that were becoming reported and positive over time as the weeks and months have now progressed since our initial stay-at-home orders. So we've also monitored any models indicating that the number of contacts that will be traced may grow, particularly as we reopen and as stay-at-home orders are lifted. We know that more people will be out and about in their community and come into contact with those who are positive or probable positive. So the essence is that community tracing will help us connect those contacts with care, testing, and treatment that they need. But the goal is to prevent further transmission of the virus and avoid a future wave that would potentially, again, put us in a situation where we're cautiously monitoring healthcare supply and healthcare resources. Next slide. On this slide, you'll see our interim current plan. We have a robust strategy in place that is helping to supplement the work of our epidemiologists and case investigators. I'll talk about their roles in a bit, but we have about 55 to 65 public health staff members who do that core function of interviewing and investigating the risks and exposures. And that requires a lot of interview questions about how long they've been in touch with someone who is known positive or probable positive. We're grateful for the leadership of the Delaware National Guard, and we have 105 guardsmen who are helping us right now do telephonic contact tracing. So anyone who is tested positive will potentially have a telephone interview by one of our National Guardsmen. We have guardsmen who speak Spanish, Haitian Creole, and are just doing a fantastic job and serving in that capacity. Additionally, we have 15 public health, community health individuals who will do field contact tracing. As you can imagine, some people may not pick up the phone and may not be easily accessed by traditional telephone means. We may not have a phone number for them. And so we do have additional individuals who will do field contact tracing. This is our plan as of right now until the end of June. I would say this is our short-term interim approach, but we also know that as things reopen, we'll need even more robust numbers of individuals who can have a part in each of these roles as we go forward and as we reopen. Next slide. So I thought it might be helpful to just understand a bit about the roles, and so that you as employers could understand how you fit in and how things may intersect with your employees. The workforce includes these case investigators. They supervise a team of contact tracers. They are the ones who are contacting a newly diagnosed COVID-19 patient that may have had a test ordered from their physician, or may have dropped by one of the other events where people are signing up for drive-through events. They explain the diagnosis, they explain the risks, and then they go through a very thorough detailed interview on anyone that could have been a close contact. There's a specific definition of close contact that needs to be considered. And I would say this is the piece that you can think about in your reopening strategies around how do you limit the number of people who could potentially be exposed to a positive individual. And that's really individuals who have been in close contact for a significant period of time within that 6 feet difference, and may have shared eating areas or restrooms. And so it's not a hallway, passing in the hallway kind of a definition. It really involves close interaction. We will then collect the contact details into a database for the contact tracers, and we will work very hard to make sure that we have as much information as possible, but sometimes we will have to really think about how we're gathering data to make sure we have contacts, address, phone numbers for those who may not necessarily have that information readily available. As you can imagine, with stay at home, many more people can remember and recall where they've been, but as people start to move around a bit more, it may be difficult to know the exact details of those individuals who are contacts. Next slide. The workforce real army is the contact tracers. These are larger numbers of individuals who are receiving the names and phone numbers of contacts. They are explaining the procedure for testing and quarantine. They're making sure that those individuals are tested quickly and that they have guidance in place. It's a lot of kind of counseling and interview and information sharing. And we are also making sure that translation services are available for those not fluent in English. Next slide. The field contact tracers are a smaller number of individuals who have largely the same role as contact tracers, but they are those who may not be able to make a phone call or send a text message. They are receiving names and potential clues, if you will, addresses for those individuals who don't have phone numbers or aren't answering calls. Additionally, we may ask for businesses to help us locate these contacts. If they identify that they were in a particular place of business, we may reach out directly to the business and let you know that someone may have been exposed, an employee or a certain location. And so knowing who's coming in and out will be helpful for that assistance and being able to help us locate contacts and those who may need to be tested, and we may need to contact additional individuals through those means. We are also trying to make sure that the field contact tracers can help coordinate testing appointments, and also really providing supports through other resources of our community partner support unit to help those who may not have adequate housing accommodations to self-isolate from those who are at risk or may need access to food resources, prescriptions, and the rest, to make sure that they are able to stay home and stay safe and quarantine to meet basic needs. This workforce it absolutely in Delaware needs to include other languages, particularly Spanish and Haitian Creole, but we are also going to make sure that we have additional relationships in place that will help us to build that trust and that connection for those who may be worried about what they should do if they are contacted by our team. Next slide. Slide 9 shows our long-term robust contact tracing plan. Again, it's stood up. It has a much more robust customer relations manager platform, Salesforce, in place to make sure we're tracking cases and contacts. We can reach back out to them regularly. They have a call center kind of machinery that's feeding and connecting into the public health team. The long-term plan beyond June 24th is to have 35 public health epidemiologists and case investigators, along with 138 individuals from NORC out of the University of Chicago, who is right now working on this robust IT platform to help guide Delawareans who will be employed through the telephonic contact tracing plan. Additionally, we will hire another group of public health, community health workers who will do the field contact tracing. And our current estimates are that we'll have at least 42 of those individuals in the field, boots on the ground, making sure that they're reaching out to those who don't have a telephone and address available. So next slide, our overall summary for the DHSS plan is that we have these 138 telephonic contact tracers in place, recruited, hired, trained. There'll be an additional level of supervisors built in. We will have not only a Salesforce platform created by a company called Innovational. Both of these entities are already in place in Maryland, and Maryland has the benefit of having a connection to our HIE, our Health Information Exchange, the Delaware Health Information Network, which is on a similar architecture to the Maryland HIE Health Information Exchange. And so what we saw as a huge advantage between our two states is the opportunity to connect those data points and data infrastructure. You can also see here that we're employing 42 field contact tracers. We'll have 3 field directors, 1 per county, where these postings are available now. If people are interested in sharing them, we're looking to hire individuals into the Division of Public Health as we speak. But their role, again, will be to find and monitor these index cases, the contacts, and find and monitor those who are lost to follow-up. And probably the most difficult and challenging piece is making sure that we have our epidemiologists and data team in place to manage the most complicated cases, contacts, particularly those who are in high-risk environments such as long-term care. Our universities, for example, when they reopen, our schools, daycares, anything that is seen as a place where disease spread could happen very quickly. We're monitoring very closely with specific additional guidance. Next slide. This is what we envision success looking like. It would mean that we are contacting COVID-19 positive patients within 48 hours of a positive test result, and these contacts will be referred for testing within 48 hours and recontacted if they don't get a lab test within 48 hours. So you can see instantaneously we have this connection to not only the outreach and the phone call, but also having documented testing status for COVID-19. We also have a particular focus on those who are socially vulnerable to make sure that we have wraparound services available for support and to keep them safe and to keep the public safe. And the critical part of making sure this is successful is that if we are successful, efficient tracing and isolation of contacts will reduce the infection rate to less than 1 additional person. If all of us are, amateur epidemiologists these days, and this are not concept of how many people spread COVID-19 based on the number of contacts that have been around is essential. We're trying to limit that with stay at home, but as we reopen, it'll be really important for contact tracing, repeated testing availability to be an essential part of our strategy. Next slide. So you'll see we also are working very hard to make sure we have the right expertise in place with division leadership at our department, and our staff already working 90 hours a week. We're working hard to make sure that we have additional support in place. Health Management Associates is a national research and consulting firm, and they've been providing us additional capacity. Particularly, they've been helping us direct the contact tracing program, train the guardsmen in the interim. They're providing immediate IT support to help us stand up more robust IT interventions. They've been conducting training for the interim field contact tracers before we hire additional staff, and acting as the field directors. We pull them into all kinds of issues. And on the next slide, you'll see this flow chart that will help. It may be too small on the webinar, but we're happy to walk through it. I think the essence of what this shows is that the idea is everything is connected to testing. So we are working to quadruple the number of tests that are available in Delaware by the end of this month, by the end of June, I should say. The days fly by. And we're making sure that our Salesforce IT platform is in place to make sure we're refreshing the lab test results every 15 minutes. If people don't have a phone number, they're forwarded down to that bottom row where the DPH field contact tracers are working to make sure they're finding the index case at their addresses and conducting those interviews, making sure people can self-quarantine. But if we do have contact information, they first go to the Division of Public Health epidemiologists who interview all the cases. And finally, we're making sure that our telephonic contact tracers are interviewing cases. They are making sure that they are monitoring during isolation and self-quarantine. They're providing clearance to those in isolation and quarantine. And we're providing that ongoing feedback that is very resource intensive and requires a longitudinal look at every individual who tests positive or may be at risk. So with that, my last slide just says thank you for the opportunity to present. I really appreciate the opportunity to share more and answer questions. And I will turn it over back to Mike for the transition, or for questions now or at the end.
Sure. Thanks, Kara. I'm going to put you on mute for just a couple minutes, and I'll bring you back for the Q&A. Let me thank Dr. Walker for that. I appreciate her slides and her presentation. Before I go to Major General Mike Berry from the Delaware National Guard, I think I neglected to share with listeners and viewers that this is an off-the-record conversation, that if anybody from the media happens to be on and has follow-up questions about anything that they hear today, they are welcome to reach out directly to Secretary Walker's office or to Major General Berry's office for the appropriate follow-up. But this is an off-the-record presentation. So with that, Mr. Berry, you are on, sir.
Well, thank you. It's great to have the opportunity to speak to you all in reference to the National Guard's response. But before I begin that, I really want to send out my appreciation to all of our employers out there, because as you know, our 2,700 men and women of the Delaware National Guard, both the Army and the Air, come from your communities, come from your businesses. And without your support, we wouldn't be available to respond as needed. The discussion on contact tracing, or as we call voluntary COVID mapping, in order to get into that, I need to tell a little bit of a backstory and take a minute or two just to make sure everybody understands just how the National Guard comes into play in a domestic emergency such as this. So the Delaware National Guard is broken down into two organizations. You have the Army National Guard and the Air National Guard, and those two organizations are the force providers. They provide forces for the federal active duty Army or active duty Air Force as needed throughout the world. And they also provide the forces to the governor in an emergency such as this. So back in March, when this event started to occur here in Delaware, of course, we were looking at it very closely and figuring out what our possible mission sets could be should we be called on. And it's very important to point out from the very beginning that we recognize as an organization, should our soldiers and our airmen come in contact or become positive themselves, then they would not be available for duty. You know, the National Guard has a motto, and it's always ready and it's always there. And we knew that we needed to be healthy and ready from the very beginning all the way through the conclusion, if there is a conclusion, if you will, however that is defined. And we recognized that it was for the long haul. This wasn't a 2 or 3 day event, a snowstorm, a northeaster, or a hurricane. We knew that based on history and based on the science and the guidance that we were getting from the experts in this field, that we would need to be prepared for the long haul. So we immediately stood up our joint task force who was working under our joint staff. And what they did was allow the transition of individuals from the force providers, as I described, on the Army and the Air, into a task force concept. And it's very important to understand that the National Guard is a support organization. We are not the lead. And so there's a process of how other agencies, in this case, Health and Social Services and Department of Public Health, they send out a request through the channels, through the Delaware Emergency Management Agency, and say, hey, we need assistance in this. And then there's going to be a mission set assigned to that. So some of those mission sets started right off with some LNO, liaison officer work, some public affairs work, even a little bit of some expertise in the medical field. And remember that the men and women that serve in the Delaware National Guard, the majority of them are not full-time. So they have other careers, and they bring tremendous expertise from the field from their jobs, their civilian skills and careers, into the ability to transmit that into a military response. And so we certainly capitalize on that. We document who has certain skill sets and what they can bring to this fight. And so we were able to respond pretty quickly. The other piece that we bring is the manpower, if you will, the bodies that the agencies, the other state agencies, don't maintain year-round, and we're able to supplement those agencies in the missions. And that's exactly what we did. So the request came in. Some of the missions included school meal distribution. We started right off the bat because we knew that the schools were closed and the kids still needed access to those provisions. We began to set up alternative care facilities around the state, knowing that should the hospitals need to surge and exceed their normal capacity, that they were able to do that, so that they would have the ability to protect it and save the lives of our citizens. We also provided medical staffing at different long-term care facilities, within other medical services throughout the state, again, because of our skill sets that our service men and women have, either through the military or through their careers. We assisted with the food bank distribution that was going on over the last couple of months, and helping the citizens get through this as a group. Care package assemblies, distribution of those care packages, and then even community-based testing. And finally, we get around to the discussion on the COVID mapping, or the contact tracing. And we knew that that was a heavy lift for the organization. So we put together a sub-task force, if you will. We brought in some folks that we knew we could dedicate to assist Department of Public Health in this mission. And everybody sat down, they developed a plan for training our personnel, and then we brought them in and we trained them over the course of a week, and established some partnerships with some other agencies with up and down the state to set up the facilities in order to do the work, whether it was the IT hardware, the laptops and the phones, to the office space to do the work so that we could still maintain our social distancing policies and guidelines. And we've been in operation for the contact tracing, or the COVID mapping, if you will, for about a week. And right now we are authorized through the 24th of June. That it comes direct from the president based on the authorizations under Title 32 502F, which is the authorizations that we are working under right now. Should the decision to extend that date go, for an example, let's say through the end of July, then certainly we will be available to provide these resources or this mission until we're no longer needed, and that may be based on the contractor coming on board, or based on the needs throughout the community as the virus ebbs and flows. That's really all I have. That gives you the background, tells you how we get there, how we are, how we came to be doing what we're doing. And again, I want to commend Dr. Walker for doing such a great job in explaining the process and the science behind the events of contact tracing.
Great, thanks very much, General Berry. Appreciate that. With that, I've got a couple of questions that have come in, so I'm going to go ahead and start directing those first to Dr. Walker. Doctor, help everyone who's on today understand some of the delays and that are inevitable here. Johns Hopkins universities and others have said that there are inevitable delays from the time you catch the virus, perhaps to the time you feel ill, you get tested, you turn out positive, and then contact tracing then begins. And it's an enormous challenge because days have passed between the time when someone was contagious and the time the results from the test were returned. So I guess this is probably the best we have, but what's I guess the solution? What are the best options here?
No, you're absolutely right, and I think this is why the most important guidance that we can give is that we all have to act as if we have COVID-19, because if we do so, it makes it easier for us to envision how the contact tracing may work, and it may limit the number of people you come into contact who may be asymptomatic. We are learning a lot about the time between symptoms, exposure symptoms, and testing positive. Thankfully, many of those wait periods have been reduced substantially. So, but that doesn't change the course of disease. What we have heard is that most people develop symptoms between 3 and 5 days after exposure to someone who is positive. They may run the course of disease and be infectious for a total of about 14, maybe even 21 days. Some people are, still testing positive beyond that 14-day time period. And so it's critically important that we monitor individuals. If you are contacted because you may have been exposed to someone, that 14-day self-quarantine is important to make sure that you're not developing symptoms and not out and about spreading it unintentionally with mild symptoms or asymptomatic pre-syndromal kinds of infectious periods. And I think that is the challenge, as you said, because it may be that you were exposed and then 3 to 5 days go and you have mild symptoms or no symptoms, and then you develop symptoms and decide to go get tested. Well, ideally what we want to do is make sure that at the point that someone else is known positive on day 0, that person who is the positive potential exposure is contacted before they're developing symptoms and before they are infectious, because they've allowed their body to replicate enough virus to infect others. So robust contact tracing is our best strategy, our best tool right now. It is the fundamental strategy of managing infectious disease around the world for generations. We've seen it work in Ebola and polio and all kinds of diseases that thankfully we don't necessarily see this mortality rate at this point in time because we have vaccines and treatments. But until we have a vaccine, until we have effective treatment for COVID-19, we have to maintain that there's robust access to testing, and contact tracing is readily accessible and rapid and happens within that first day or two of someone else becoming known positive.
Appreciate that. To Major General Berry, so how can employers work with the Guard to assist in contact tracing? Mike, what are some of the best things that employers can do to help your team in their mission?
Really, it just boils down to supporting the men and women within their organization or their company that are members of the Guard, and certainly, whether it's, again, as I mentioned, whether it's a snowstorm or a year-long deployment, that support is so important to our personnel, because if they are under a lot of stress about the conflicts that may arise between their civilian employment and their service to the country, to the community, it makes it difficult for them to be able to perform that mission and maintain the focus that it requires in order to produce the level of professionalism that we've come to expect from our armed forces. So not only with contact tracing or COVID mapping, but all of the missions of the National Guard and the reserve components at large, it's critical, and we can't thank you enough. If you have folks in your company that are part of our organization, for giving them the time to come on board and help us. We try to minimize it as best we can. We recognize the burden that it places on the businesses when we pull your members or your teammates off to assist us. But in times like this, we also recognize just how important it is, and to be able to provide that service. So at the end of the day, the community is safer and the community is more healthy. So again, that's the best thing that we can ask for. Thank you.
Appreciate that. Dr. Walker, back to you. Fran Denuso from ILC Dover asks, are there any baseline testing protocols planned for the entire Delaware population to measure the current spread of the virus in the state?
So we are building off of our Sentinel surveillance testing system, and I wish there was a simpler word for it. I'm sure we'll come up with something soon, but the idea is that we're testing a set percentage of the population that both has symptoms and does not have symptoms, so we understand how much virus is in the public. And that's something that we use every year to understand the prevalence of influenza. And we will have testing partners who will do this surveillance to make sure that we're monitoring how much virus is out in the public. It is part of one of our dashboard measures. If you look on My Healthy Communities Delaware on our dashboard website, you can see that there's one graph that looks like a big spike and then a decline. It's the influenza-like illness, and those symptoms of cough, congestion are going to be part of what we also continue to monitor. It'll become more complicated once we re-enter the flu season again in the fall, to separate out the difference between flu and coronavirus. But that again is why it's going to be really important to have this baseline surveillance available through the summer and through the fall. And then we will continue to see what happens as we enter into the winter months when flu typically peaks.
Got it. General Barry, back to you for a moment. So how will members of the Guard actually be in touch with people around the state? I think you touched on this a little bit, and I think Dr. Walker did as well, but there's going to be telephone calls, going to be text messages, in-person interviews. So if somebody hears from the Guard, presumably that's not a recruitment call. It might be something that's very serious like this. What can people actually expect, or what can employers tell their employees what those contacts may look like?
Right now, the mission simply calls for telephone contact, and that's what we are doing, providing that service on behalf of the Department of Public Health. The discussion that Dr. Walker talked about with the community contacts going door to door, if you will. Right now, the need for the Guard to participate in that mission is not there. And then the mission may change, but right now it's via telephone.
Gotcha. Thank you. Dr. Walker, back to you. So,
and I could add a little bit to that too.
Sure.
I think it's really important that employers do share that if someone from the state of Delaware or public health shows up on your caller ID on your phone, please do answer it, because we do want to make sure that we are getting an opportunity to talk to people. And in the day, when there are many scams and other kinds of robocalls happening, we have identified through caller ID the phone number should be labeled State of Delaware or Public Health. And so really appreciate you working with everyone to make sure that they know that those should be considered trusted sources of information. And as we train up NRC for the long-term plan, that caller ID will look the same. It'll be a Delaware number. It won't seem like it's calling from some other kind of a scam-like identified information. And we will also incorporate text messaging if possible, but that has to be first activated by consent. So after the first phone call, we will ask if we are permitted to send text message follow-ups to check on people and see if they continue to have symptoms. Part of the way that we're going to reduce the burden on people reporting in and hopefully complying with the self-quarantine is just trying to make sure we're not, overwhelming people with phone calls.
Understand.
Thanks.
Yeah, understand. So, Dr. Walker, staying with you for a minute. So this is a real challenge because employers worry about compliance with the law and regulation, and there's, as you're familiar, and you and I have talked about this before, the HIPAA statute creates a lot of worry amongst employers, large and small, in the name of contact tracing, and then having an employer alert maybe their employee base that they need to self-quarantine. If you're an operation that has 300, 400, thousands of employees, maybe if I go out for a week or two, I'm missed by a small, well, my team probably wouldn't miss me, but if I left for a while, the issue is really a problem if you have a small employer with, say, a head count of 10 or 15. If I were to go missing for a while and they said, hey, we had somebody here that tested positive, it's going to be pretty easy by process of elimination know who's ill. We're in kind of funny ground. What are your thoughts about any of that?
Yeah, I agree. I mean, under normal circumstances, it would be completely inappropriate to share, personal health information with coworkers. But in this case, because of the number of cases and the risks for everyone involved, we have certainly been put in a different kind of environment and time when we do need to consider how we share information and how we contact individuals who may be positive. And once we got well above, hundreds of cases a day, we no longer could do so from public health, because early on we had, public health reaching out to any possible contact, and that just very quickly became a limiting resource factor. So, I would say for small employers, treat it carefully, but it certainly is one where you'll have to go on a case-by-case basis based on the risks of others who may have been exposed, and let them know that they may be, again, contacted and notified if they need to self-quarantine. It is challenging, and again, the best guidance is try to keep everyone safe so that they limit their exposure, but there may be situations when you do have to notify others and do so carefully and cautiously.
Appreciate that. General Berry, back to you. So what experience have your colleagues in other states reported on, and what are some of the best practices, or is everybody kind of in this together where Guard forces have been similarly missioned and are standing up folks to assist with all of this? What are some of the things that maybe you've heard from other states or other adjutant generals where some of those ideas can be imported into the steps you're taking?
You made a great comment about everybody is faced with the same thing across all 50, we call it the 54, the states and the territories and the District of Columbia in the Guard. And right from the beginning, the Chief of the National Guard Bureau organized conference calls where all 54 adjutants generals were able to come on board. It was every day. Then we went down to 3 a week, 2 a week. And we were able to talk about lessons learned as this was developing, and as it really worked its way across the country, we were able to watch or listen and learn from our partners across all 54. And mission sets, believe it or not, were very, very similar. In the more urban areas, New York, some of the bigger city environments, some of the mission sets were different, and the number of guardsmen that were mobilized certainly was based on those mission sets. But again, a lot of the points of distribution, we call them PODS missions, the medical staffing assistance that was provided, again, all 54 were doing the same thing. And then when it comes down to the contact tracing or the COVID mapping, there's only about 5 other states that are doing that piece of it right now, and really that's simply the direction of those states' Department of Public Health. And some states may choose not to go that route. But when this popped up on the radar for us, we knew that it was going to be, as Dr. Walker explained, an extremely effective way, one of the only proven ways by science to combat a pandemic. And of course, we have experts within our organization that were able to help explain that to me and explain it to the leaders, so that we were able to prepare a plan. So when the request came forward, we were able to react.
Appreciate that. Thanks very much. Dr. Walker, back to you real quick. So I know that in visits that I've had with Nick Moriello, our sponsor from Highmark Blue Cross Blue Shield, he's a parent as well as myself. Mine are college age. Nick's got a young daughter. There's a lot of families who are going to face some real stresses going forward, because there have been some national statistics that suggest that about 1/3 of childcare daycare facilities in the country may not reopen after all of this, and that's going to present a completely different set of challenges, one that's going to be a subject of one of our webinars coming up. But in the name of healthcare and kids, and little kids in particular, now I know that the incidence rate of the virus with younger people in the population hasn't really shown itself to be as dramatic as it is for people who are vulnerable and older and with pre-existing conditions. But let me just ask you kind of a large macro question. What do we do with young kids, especially small ones, as they maybe return to daycare facilities, and what are some of the things that you're thinking about and ways in which they can remain safe?
I think that it is a real challenge because obviously as we start to reopen, we'll need robust childcare in place that keeps our children safe and keeps them from transmitting it to loved ones and family members. Often grandparents and others are in touch with these young ones, or they work in childcare facilities. What we have seen is that children seem to fare pretty well with coronavirus. Fortunately, there are some small reports of this multi-system inflammatory condition that is pretty severe, but it is rare. We're learning more about it. And so I think balancing the risks right now is a challenging conversation. And certainly glad that you're going to be talking to the childcare facilities and experts. I'm a mom of little kids. I have a 4-year-old and a 8-year-old. And so I think thinking about school and daycare is not just part of my job, but definitely part of my personal life. And I think it's just going to be a balancing act where we have to try to think through the risks and safeties and measures that can be in place. And the idea and concept that is moving forward in our nation is that daycares will need to open, and we will have many probably reduce the number of children who are able to be served, and some because of business issues, some because they just want to make sure they have fewer kids coming in contact with each other. And we'll be trying to figure out how to do that and limit the exposures and risks. But it is going to be an ongoing challenge, and one that we're going to have to cautiously monitor and keep an eye on and manage. But what we certainly know is that until we have a vaccine or a cure, we're all going to have to manage these risks every day for our family and for our loved ones. And for some, it may mean keeping kids home if possible. And for others, it may not be a possible scenario. And so I'm trying to really think through what are necessary risks versus unnecessary risk is going to be a part of our new normal.
Appreciate that. Major General Barry, back to you for a second. I know that you mentioned this in your remarks that funding and the Guard's role in this could end in a matter of weeks unless funding and the authorization is extended beyond that time. It seems based on everything that you've said and what Dr. Walker said, contact tracing is very important. We see some experiences in places around the world that did this quite well, like South Korea, maybe Taiwan, very aggressively, and kind of helped to tamp down the spread of the virus. I know you don't have a crystal ball, but if you were and some of your colleagues, do you think the extension beyond June is maybe in question because, as you indicated earlier, there's only a small number of you that have been tasked with this mission by your states? What's the likelihood of the role of the Guard going forward beyond June from your perspective?
So the authorization to extend beyond the 24th of June really covers down on all the different mission sets. It's more broad than just contact tracing. It covers down the total COVID response, and the contact tracing, or the mapping, if you will, is just a small part of that. In reference to specifically within Delaware, the mission requirements really would be driven by the contract itself when they come on and stand up, because remember, the Guard is just a stopgap in covering down so that the mapping can take place now when it's needed, and we're filling that role, and then eventually it'll just roll over, even if it extends till the end of July with the presidential authorization. The mission for us may end, the 2nd or 3rd of July, based on the contract. So as Dr. Walker and her team work on keeping their mission, their plan moving, the role of the Guard as a support agency really is just whatever they are requesting assistance in being able to or needing to be provided for them.
Gotcha. Thank you. Well, let me, I'm going to make a couple of other quick comments here, and then I'm going to turn it over first to Major General Berry for any summary or closing comments that he'd like to make on anything he heard today. And then also we'll go back to Dr. Walker for any closing comments she has to make. So let me first remind everybody that next week we've got a program that we've got planned with Secretary Saran Cade, who's Delaware's Secretary of Labor, and Ron Painter from the National Association of Workforce Development Boards, who are going to talk to us about innovative ideas and ways in which we can get people who may presently be idle and unemployed, which is really, really sad. And unfortunately, many won't have a place of employment to go back to because perhaps that business is out of business. So it's really critical that we think about how we can upskill and retrain segments of our workforce and get them back in a career path that has a future and a success orbit. So we'll be talking about that next week. We don't have a sponsor for that quite yet. So if somebody's out there and would like to sponsor that, we would certainly welcome that. Let me just personally say thanks to General Berry. I've been an honorary member of the National Guard in the past, and it was a terrific experience. And Dr. Walker, also let me thank you for your participation here today, and for both of you and all the men and women that work in your respective organizations for all that they do. So with that, General Berry, any closing comments first from you?
Yeah, again, I'd just like to thank all the employers for allowing your employees and our servicemen and women to be able to do what they do. You know, it really boils down to neighbors helping neighbors, and those folks that have been mobilized in the Guard in this response and you know, many responses over the years. They're members of your family, they're your friends, they're your neighbors, and that support that you show them when they leave their homes and their families and come in to support the community at large, it really is important, and we can't thank you enough. Again, thanks for this opportunity to be able to present to such an important group. You know, we know that the businesses are what keep our country strong and certainly our economy strong, and without their support or your support and your interest in what we do to help provide a safe environment for you, you know, it goes without saying that you know, we are all on one team. So again, thanks again for this opportunity.
Major General, thank you very much. And Nick Moriello from Highmark Blue Cross Blue Shield, thank you again for your sponsorship here today. Dr. Walker, any closing comments from you?
Thank you so much, and thank you for the opportunity. Thank you to General Berry for the National Guardsmen and their support. We would not be where we are without them in so many ways. I also just want to continue to encourage all of our employers to reach out to us if you have questions. Continue to educate your employees, encourage them to stay home if they're sick or think they may be in contact with someone who is symptomatic, and let people know that help their neighbors, help loved ones, and if they need assistance, they can call Delaware 211 for support from everything from food, delivery of prescriptions, rent, utilities, or even just behavioral health supports. We're in a time of a lot of stress and anxiety, and your help with making sure people know where to go is incredibly, incredibly important and valuable. We're in this together, and we will get through this, but I appreciate the opportunity to share information today. Thank you.
Great. Well, thank you both very much again. We look forward to our session next week. This will be found, you'll find this webinar on our website sometime later today, and you can review all of it in detail at your own pace, share it broadly. Again, our thanks to the Delaware National Guard, Major General Mike Berry, and to Delaware's Secretary of Health, Dr. Odom Walker, for participating here today, and Blue Cross, Highmark Blue Cross Blue Shield of Delaware for their sponsorship here today. So thanks, everybody. Be safe out there, and we will be speaking with everyone again. Thank you.